Our next speaker, Krisstina Gowin. She was a fellow at our center. She is now, however, assistant professor of medicine at the University of Arizona down in Tucson, a few miles away. She completed training while in her fellowship also in the Andrew Weil College of Integrative Medicine in Integrative and Complementary Medicine. She has authored many peer-reviewed journal articles. She's working with me to move forward with possibly creating a fellowship in integrative medicine for oncology folks. I admired her so much, I enrolled in the Andrew Weil College of Integrative Medicine myself this last year. And so she and I share a lot. She's passionate about wellness and she lives what she preaches. So without further ado, Dr. Gowin.
Thank you so much for that introduction. And I'm just so honored to be here today. And I'm just so impressed by all the speakers going with the flow and the audience being so patient and having so much gratitude. So thank you while I share my screen. And move to presentation mode. Can you see my slides?
Yes, can.
Great. So today I have the unique opportunity to talk to you about attaining your optimal health with integrative medicine. As John mentioned, this is an area of passion of mine, so it is certainly with gratitude that I get to speak on this subject. So optimal health, I'd like to invite you to take a moment to envision what this means for you. What is your optimal health? What does your body feel like? How do you spend your time if you're in your optimal health? And I'd like to envision what are the steps that you can be taking today, tomorrow, and even in the next coming weeks and months to become closer to this vision that you have for yourself for optimal health. And I imagine as you're envisioning your optimal health, you're probably thinking about, what can I do in the lifestyle? How can I eat better? How can I move more often, more meaningfully? But I wonder if you're also thinking about stress reduction and the care of your mind. Are you thinking about promoting more joy and gratitude and laughter in your life? Are you thinking about more meaning and how you can promote meaning in your life? And it's really all of these modalities together that surround really this basis and foundation of conventional medicine that moves us closer to this ideal of optimal health. And what's wonderful about this is that you have the power to promote your own wellness with these tools. So today in 20 minutes, we're trying to accomplish a lot. We're going to discuss what is integrative oncology, to discover why integrative care is important in MPNs, to review some lifestyle medicine interventions, emphasize the care of mind, meaning, and joy, and to consider some complementary care modalities. So what is integrative oncology? And this is really developed by our Society of Integrative Oncology, and it's a patient-centered, evidence-informed field of cancer care that utilizes mind and body practices, natural products, and it says and or, but I really think it's and, lifestyle modifications from different traditions alongside, and this is really what makes it different from alternative or complementary medicine. It's integrative medicine, meaning it is alongside conventional cancer treatments. Integrative oncology aims to optimize health, quality of life, and clinical outcomes across the cancer care continuum. And I love this, to empower people to prevent cancer and become active participants before, during, and beyond cancer treatment. And so I really like that definition, and so I think it's important to share it with you. And why is it important, and why is it particularly important in those afflicted with myeloproliferative neoplasms? And Dr. Mesa very eloquently shared this earlier, the concept of symptom burden, and how we now have defined it so well, and we now have tools to measure it accurately over time. And what this allows us to do is really to say, we know, even though we have phenomenal pharmacologic and transplant therapies, that there's still this unmet symptom burden. And so this is where integrative oncology perhaps can really contribute to the wellness of our MPN patients. We want to decrease inflammation, and we'll talk a little bit more about inflammation, and this was already touched on and will be touched on more in the day. But potentially lifestyle medicine can impact inflammation. We know that MPN patients already desire and are already utilizing complementary care modalities. And there is the potential to impact the outcomes of the disease and treatment toxicity, as well as to decrease the cost of care. This is a foundational paper that was published in 2011 in regards to the pathogenesis of cancer in general. And these are the drivers of cancer. And as you can see in the orange box, which is enhanced here, that tumor promoting inflammation is a driver of cancer. And what promotes inflammation? Infections, obesity, smoking, alcohol, environmental pollutants. All of these things are truly propagating this concept of inflammation and cancer pathogenesis.
Krisstina,
yes.
Question. Is there a way to make each of your slides bigger so that we don't see the next slide coming? You've got such detail on some of these slides. A couple of people have asked that.
Oh no. Is that bigger?
Now they're gone. I shouldn't have said anything.
Oh dear.
Your slides are gone. Go back to share, and then what we were looking at was probably your view, where there's a slide on the left and then a smaller slide that's the next one on the right, and I couldn't see the detail.
Let me try. I played from current slide. Let me try presenter view. Is that the same?
It sounds better.
Better. Okay. So we know that.
Can anyone? Can people see her slides? Because I cannot.
No, not yet.
Yeah, they're not up. You might have to go back to share screen and do it again.
Oh boy, John, you really opened Pandora's box here.
And up to now, you had the quicker delivery of slides than anybody. So
well, I wanted my maximal time. This is really.
I'll give you extra time.
I'm just kidding. I don't even know how to get back to share. Hold on, here we go.
You see the thing at the top says there, something's happening. There they are.
Okay.
And then.
Okay, so let me try again at risk of.
Presenter mode,
Oh, it did it again. Is it the same?
Yeah, we can live with it. I'd rather hear your whole talk than to interrupt it again.
Okay, sorry about that. I'm not sure how to make it full screen. So MPN inflammation. So we know that inflammation really is a driver of myeloproliferative neoplasms, the pathogenesis, but also the progression. But I think what's really interesting and important is that inflammation correlates with some of our MPN outcomes. And so we know that with high markers of inflammation, as measured by high sensitivity CRP, increased risk of major thrombotic events are seen. And this was published in 2011 and 13 by Barbui. And there's also a shortened leukemia-free survival. There's a really wonderful review, which you can look up, Lusana 2017, which that smaller box, which is probably very small for you, you can read more about that. But how do you impact inflammation? And one of the most foundational ways to be impacting inflammation is truly through lifestyle medicine, through diet and exercise. We know that both of these are potent modulators of inflammation. And our Greek father of medicine, Hippocrates, very eloquently described it with his quote, "Let food be thy medicine and medicine be thy food." And we're still building our evidence base in myeloproliferative neoplasms. And there are trials coming up, and you'll hear more about this by Dr. Fleischman later in the day. But the best evidence truly comes from our cardiovascular research colleagues. And they did a very large randomized trial. It's called the PREDIMED study, where 7,000 patients were randomized to a Mediterranean-based diet with either extra virgin olive oil, nuts, or a control group, which was a low-fat control. And what they found is those that had higher quartiles of intake of these Mediterranean diet foods had lower incidence of cardiovascular thrombotic events and cardiovascular death. We also know that Mediterranean diet modulates inflammation, and this has been shown in many different studies, and CRP was one of those. I'll tell you, I could spend probably hours talking about diet and cancer care. And I know we have another talk later in the day that's really focused in on nutrition, so I won't spend much time here, but I do want to just mention a couple things which I find are very fascinating and interesting is intermittent fasting, whether it's time-restricted feeding or alternate day fasting. There's phenomenal research coming that supports age, longevity, increased health of our chromosomes, differential genetic impacts such as epigenetic changes. There's decreased or increased tumor suppressor proteins, DNA repair. So really interesting things coming with intermittent fasting, so stay tuned for that. Ketogenesis is very interesting, and the microbiome we're finding is so important in cancer outcomes, and there's very interesting data about the microbiome and transplant and how we really want to be enhancing our microbiome diversity to get the best outcomes with transplant, decreased rates of graft versus host disease, etc. So I will let Dr. Fleischman talk more about the dietary aspects in her nutrition lecture. Physical activity. So physical activity is decreased inflammation, and activity is seen with physical activity. There's decreased rates of obesity, decreased stress, decreased depression. And Dr. Massa did already introduce this NPM yoga trial, which we have completed. It was a small trial of 60 patients that were randomized between at-home yoga versus a waitlist control. And we looked at their symptom burden as well as the marker of inflammation via tumor necrosis factor alpha. And in this trial, we had 48 patients, and they averaged a very modest amount of yoga, 40 minutes per week. And there was a significant decrease in the inflammatory marker tumor necrosis factor alpha from baseline to week 12. And there was a small to moderate effect size for sleep disturbance, pain intensity, anxiety, and depression. Another MPN-specific study was a 5-day interdisciplinary exercise-based rehabilitation, kind of an intensive instruction, followed by at-home exercise program of 48 patients, again, looking at symptom burden. And in this study, they did not find significant difference on fatigue or QOL, but they did have an increase in the physical capacity. In general, there is a lack of data in the hematologic disease spectrum for physical activity interventions. We do have generalized guidelines from the American Cancer Society, which is a minimum of 150 minutes of moderate intensity or 75 minutes of vigorous intensity activity each week. There was a wonderful breast cancer meta-analysis done by McNeely, which looked at 136 physical activity interventions. And I like how it breaks it down into these different categories: cardiovascular, strength, and flexibility. And that to get the best benefit from your physical activity is truly to be focusing on all of these different modalities of physical activity. There is significant data in breast cancer, colon cancer, that there's improved cancer-specific and overall mortality for physical activity across the board. And what's interesting is that there are different doses and intensity levels within the different disease diagnoses. And so I think we're going to have to come up with our own MPN-specific exercise prescription after we've done more randomized controlled trials in this. So we've really honed in this morning again on conventional medicine, and then the very top circle of this diagram, lifestyle medicine. But I'd like to hone in now on the mind, joy, and meaning, which is so important in your overall wellness. And I'd like to give you some homework to go home with today, in that joy is so important. And so trying to practice joy daily, having an intention for joy daily via a daily joy intention, or greeting the day with gratitude. These are exercises. Hopefully you'll be able to read the slide set as they're shared later. The 4-7-8 breathing, we also know that breath really enhances your stress patterns and can be a very efficient tool for stress reduction. And we also know that stress is a significant driver of the changes that we can see within a tumor microenvironment. And those are changes for the worse, that there's increased metastasis, increased angiogenesis or blood cell formation with stressed animals and people. So stress reduction really is good medicine. And in my consults with patients, I always teach this 4-7-8 breathing technique where you do 4 cycles of a breath, holding, taking a deep breath in for 4, you hold it for 7, and you breathe fully and intentionally out for 8. And so I invite you to experiment with that, and there are YouTube videos for that. And then Dr. Messa also mentioned the Calm app. This is now NIH funded to be studied in MPN patients and others. And this is a meditation app which can be obtained and experimented with. A slew of complementary modalities are available, and I really try to personalize the patient's receptivity and interest to these different complementary care modalities. But I'd like to highlight that 40 to 60% of patients are already using some sort of complementary modality. One of the most evidence-based modalities is acupuncture. In 2016, they came together and all different scientists, acupuncturists came together and said, is this safe and effective in cancer care? And their outcome was, yes, it is safe and effective, and in particular, in relation to pain management and management of nausea, it truly can be effective. Anecdotally, I also see this being quite effective for fatigue, sleep, smoking cessation. So certainly it can be something to be tried. And a good trial is weekly for a period of a month to see if there's a good impact. Botanical medicine. So this can be truly a 3-day symposium in of itself. But I'd like to leave you with some resources, because the key to botanical medicine is to be sure you're doing it in a safe and with open disclosure with your provider. So the Natural Medicines database is a wonderful resource. It does require a subscription, but once you do subscribe to this, you can actually put in your systemic chemotherapy and other medications and the botanical of interest and see if there are drug interactions. You can also view the efficacy, all the trials that have been done, and any safety signals. The Memorial Sloan Kettering About Herbs also is a great resource. And what is nice about this is that there is actually a mobile app where you can download on your phone. There are issues with botanicals. And so we're worried about source and contamination, potential pharmacologic interactions, which I mentioned, safety, bioavailability. Just because you're ingesting it does not mean that it is absorbed well. There's difficulty studying botanicals. There's difficulty with sourcing of the botanicals and funding the studies. And this is why I like the picture of the kind of clear capsule filled with food, because with botanicals, often we're isolating one component of a plant. And with plant medicine and a whole foods-based diet, you're really getting the benefit of all that plant has to offer in a synergistic way that nature intended. So in general, I really like food as medicine. That's my approach most of the time. But if you are choosing to supplement, you should be aware of good quality supplements that are out there. The USP, Consumer Laboratories, NS stamps of approval really look at the quality of the products. So I added this slide literally minutes ago because there was a question from the audience about, is there a natural product out there that inhibits the JAK-STAT pathway? And yes, the answer is yes. And there are a slew of them, actually, quite a few. This Resveratrol, the active ingredient in red grapes, curcumin from the rhizome turmeric, the Indian spice that curries are made of. We have EGCG, which is the active ingredient in green tea, and many others. And notice the structure of all of these JAK-STAT pathway inhibitors and how similar they are to ruxolitinib, our JAK inhibitor that is FDA approved. So I found that really interesting. But I would say that none of these are tested yet. The dosing and safety with other medications are largely unknown. And so my recommendation is to have a glass of red wine in moderation for your resveratrol. Perhaps cook with turmeric and pepper so you can absorb it, and drink your green tea. We were curious of what MPN patients were already doing in the setting of integrative medicine. So we performed this survey-based analysis of integrative medicine use in the population. We found 858 patients who were willing to take our lengthy survey. Thank you if you were one of them. And there was a broad spectrum of integrative therapies that have been utilized: aerobic activity, massage, yoga, nutrition, strength training, acupuncture, and meditation. Interestingly, about half of the patients were using natural products in the last 6 months, but only 20% of those patients were disclosing that use to their treating provider. Only 24% received nutrition advice, and 80% felt their integrative needs were not heard by their provider. So that tells me we certainly can do better. We looked at the top 10 supplements that were used in the patient population and correlated that to the MPN symptom assessment form and the brief fatigue inventory. And there were no statistically significant associations, with the exception of omega-3 supplementation. There should be caution with omega-3 supplementation, in particular with high doses, because it can increase the risk of bleeding, particularly if there's concurrent anticoagulant. And I do want to say that interpretation of this data is very cautious, because this is all correlation, association, and it is not a randomized controlled trial. We did look at the MPN symptom assessment form, quality of life, and depression, and we found that there were some other associations that will help to direct further interventional trials. But again, these are not causative, they are just kind of interesting. The take-home study points: there's a high need for integrative education and research, and there's an extreme need for you as patients to be communicating with your healthcare team about what you're interested in and what you're doing. So this is the most recent endeavor looking at an integrative mobile health app that was developed by the Arizona Center of Integrative Medicine called My Wellness Coach. This is a free app that's already freely available on the App Store. We tested it in 30 MPN patients, and we encouraged them to set up 2 goals in the 7 domains of wellness. And then we asked them at baseline and at 12 weeks some of their symptom burden. And we found that 43% set up at least 1 goal and 53% were retained. So it was a feasible study. But interestingly, the total symptom score was actually improved 12 weeks post-intervention. There was no significant impact on sleep, diet, physical activity, but it was a very small number. So we're hoping with a larger in our trial that perhaps will be shifted. And we plan to do another phase, including health coaching and inflammatory biomarker assessment. So I think this is really the future of integrative medicine, is that it's not just, physical activity or diet, but it's really these multi-system, multi-domain wellness interventions that truly will have the greatest impact on our patients and you. So the take-home points are to discuss your treatment plan, please, 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 with your providers. Eat intentionally and be mindful of what you're eating. Move often, breathe, and manage your stress, and cultivate joy. And so I'd like to thank the MPN Quality of Life Study Group. They are phenomenally supportive and are doing great work. And it's just an honor to, again, speak and be here today. Thank you.
Thank you, Dr. Gowin. That was excellent. Appreciate it. I feel like going out and jumping on my bike now. But we're not ready for that yet. Again, we do encourage everybody maybe to stand up and stretch, and do so as I get ready to introduce